Every woman lives through about 450 menstrual cycles in her lifetime. These rhythms shape her health, mood, and fertility. Men don't menstruate, but they also have hormonal cycle, daily, monthly, and even seasonal rhythms. Women often experience premenstrual syndrome when they feel more irritable and their mood swings. Men can also go through the similar process called irritable male syndrome, which happens when testosterone level dips. This hormonal fluctuation guide our life, mood, and fertility. That's why we will talk about women's menstrual cycle. Women have monthly hormonal rhythm, which we call menstrual cycle. It prepares body for possible pregnancy and also affects mood, energy, and overall health. On average, it lasts about 28 days, sometimes more and sometimes less. The menstrual cycle starts with menstruation, bleeding from the vagina. Usually, menstruation lasts for 5 days. The day 1 and 2 of the period, estrogen and progesterone are at the lowest level of the cycle. That's why many women feel fatigue, irritability, sadness, and brain fog. During menstruation, the bleeding comes from shedding of the inner lining of uterus. Before menstruation, the drop of sex hormones causes closure of blood vessels. When blood supply stops, the inner lining of uterus is no longer nourished, and this leads to its shedding, seen as menstrual bleeding. Actually, during menstruation, dead and necrotic tissue fragments and pooled bloods in the uterus are shed. It is not active bleeding from open blood vessels, but a controlled shedding process. After about day 2 and 3, estrogen slowly starts to rise again. Symptoms usually begin to improve and menstrual bleeding stops gradually. Average blood loss during menstruation is around 50 milliliters up to 80 milliliters. If it is more than 80, it is called menorrhagia. Menstrual pain dysmenorrhea affects almost 70% of women, and sometimes it is very painful. The pain is caused by prostaglandins, which increase during uterine contractions. Heavy bleeding can lead iron deficiency anemia. It is seen in 20% of women with heavy period. Period blood is not dirty, it is sterile when leaving the uterus. The shortest menstruation documented is about 1 day, and the longest can last up to 10 days. When bleeding gradually stops, energy and clarity return step by step because estrogen rises again and everything starts to improve. It is called follicular phase. It lasts roughly from day 1 to 13. It actually overlaps the menstruation at start, but we still call it follicular phase because follicle stimulating hormone activates the ovaries to grow several follicles. Usually one becomes dominant. In the uterus, estrogen builds a new endometrium and a fresh lining. It prepares for possible pregnancy. When the lining becomes thicker, blood supply increases and glands start forming again. This means the uterus is already preparing for the next chance of conception. In the brain, estrogen boosts serotonin and dopamine. Because of this, mood improves, motivation returns, and many women feel more social and creative. Stress feels easier to manage because estrogen lowers cortisol level. Skin often looks clearer because estrogen reduces oiliness and support collagen. Exercise feels easier because oxygen delivery to muscles improve and recovery is better under estrogen. The follicular phase is the most variable phase of the cycle. It can be short or long, depending on how fast the dominant follicle matures. Usually it lasts around 13 days. This follicular pace can vary widely from 7 days to 21 days. That's why some women have short cycles and others have longer cycles. Women often report feeling more attractive and confident, which is evolutionary and linked to fertility. A woman's appetite often smaller here compared to the luteal pace. Estrogen improves arterial flexibility and the heart rate is at the lowest level at this stage. Vaginal discharge becomes clearer and stretchier as ovulation approaches. Skin hydration improves and wrinkles appear less visible in this phase. Around day 14, ovulation occurs. Ovulation is triggered by luteinizing hormone surge released from the brain. The dominant follicle ruptures in the ovary and the egg is released into the fallopian tube. At this moment, estrogen is at its peak. Libido rises because estrogen and testosterone both peak together. Confidence, energy, and social drive are often at their highest level. Some women also notice mid cycle pain. This pain can be caused by follicle rupture as the egg travels into the fallopian tube. Body temperature rises slightly around zero point 0.5 degrees Celsius, and this can be tracked as a sign of ovulation. This is called fertile window of the cycle when the egg is released. It is the best time for conception. If sperm is present, fertilization can occur. If not, the cycle moves into luteal phase. And the story continues. Ovulation usually happens 12 to 16 days before the next period, not always exactly on the day 14. The egg survives around 24 hours, but sperm can survive 3 to 5 days. This explains the fertile window. Libido peaks at this time. Women are more likely to initiate sex during ovulation. Ovulation predictor kits detect luteinizing hormone surge, which happens about 24 hours before ovulation. Even facial attractiveness is rated higher in ovulating women by stranger in studies. After ovulation, the second important stage begins. It is called the luteal phase. The luteal phase is usually lasts about 14 days. It starts on day 15 and ends day 24. This pace is more stable compared to follicular pace. Its length can vary slightly, a few days shorter or longer, but never very short or very long. In the luteal phase, the empty follicle in the ovary transforms it into corpus luteum. It produces large amount of progesterone and small amount of estrogen. Progesterone prepares the uterus for possible pregnancy, making the endometrium thicker, richer in blood vessels, and full of nutrients. If fertilization occurs, the corpus luteum keeps producing hormones until the placenta takes over. If not, the corpus luteum shrinks after about 14 days and both progesterone and estrogen levels fall sharply. This drop triggers the start of next menstruation. Many women feel premenstrual syndrome in the last 7 days of the luteal phase. It happens because sudden drop of progesterone and estrogen strongly affects the brain, and PMS appears in 75% of women. Serotonin level decrease. It causes mood swings, irritability, and sometimes depression. Progesterone breakdown products, neurosteroids act on GABA receptors, cause fatigue, sleepiness, and sometimes anxiety. Hormonal shifts make the body retain more water and salt, lead to bloating, breast tenderness, and swelling. A sudden estrogen drop can trigger headache or migraines. Inside the luteal phase, there are emotional and physical differences. From day 15 to 21, progesterone rises. Women often feel calmer, warmer, and sometimes more tired. Body temperature stays higher. After day 21, if no pregnancy occurs, hormone drops. This is when premenstrual symptoms appear. Other common signs of premenstrual syndrome is food cravings because serotonin changes and the body increased need for quick energy, sleep problems because falling progesterone no longer supports deep sleep, and skin breakouts because estrogen is low and androgens dominate. At the very end of luteal phase, when progesterone and estrogen fall, uterine lining can no longer be supported. It breaks down and sheds as menstrual bleeding, and the new menstrual cycle begins. If we say how to support women to have more harmonic menstrual cycle, for premenstrual syndrome, magnesium 400 milligram helps to reduce cramp, lower PMS irritability, and improve sleep by calming nerves. Omega-3 supplements, 1 to 2 grams per day, also reduce prostaglandin and ease menstrual pain. They also improve mood and stability. Light exercise during period is possible and favorable because endorphins lower pain and serotonin lifts mood. Even walking or yoga decrease cramps in about 60% of women. Vitamin B6, 50 to 100 milligrams daily in luteal phase, helps boost serotonin production and reduce mood swings, craving, and breast tenderness. Ibuprofen 400 milligrams every 8 hours if needed help for menstrual pain because it blocks prostaglandins which cause pain and heavy bleeding. Limit caffeine and salt late luteal phase because caffeine worsens anxiety and salt increases water retention, bloating, and breast tenderness and pain. Cutting back reduces PMS intensity about 40% of women. Some women feel no sexual desire while others feel more relief from cramps during sex. So libido varies. Orgasm can actually help cramps because oxytocin makes the uterus contract and then relax, which eases the muscle. Lubrication is natural during menstruation, but the infection risk is slightly higher because cervix is slightly open. Since ovulation can occur early and sperm can live up to 5 days, contraception is still needed through pregnancy at this stage is less likely. Sex during menstruation is considered safe medically if hygiene is kept and both parties feel comfortable.